I'll be reporting back on the health and wellness breakout that Kristen facilitated, and we started out with sort of a discussion of like what factors contribute to health and wellness, which was really interesting because a lot of people just assume it's like more medicine, and actually that's probably a very small part of what constitutes health and wellness for people. So we mentioned things such as having, not only being fit and exercise, but a good diet, social connections, having access to nature, the outdoors, safety and security in the community, solitude, knowledge and education, the environment overall, whether or not it's toxic or a healthy environment you're living in, access to health options, medical care, we just mentioned that earlier, spirituality, sort of the sense of who you are as a person, self-worth, psychological health, meaningful work versus drudgery, which a lot of us feel like we're doing all the time, having a life that's challenging. So those are all different things. We sort of linked that into the Maslow's hierarchy of needs, which we've already mentioned, like the sort of idea like you need to have your basic needs met, like food, shelter, water, that type of stuff first before you can move on to caring about other people or your community. So and that's all part of eventually being a self-actualized individual who can care about more than just yourself and your immediate needs. And so then Kristen shared some videos related to two different case studies of sort of wellness projects, health wellness projects. One was the Lehigh Valley Hospital in Pennsylvania, which is, I know many people are familiar with this example, but it's a former steel town. There's a lot of poverty. It's a very diverse community. There's a food desert. I mean, it has a lot of challenges as a community. So there's this hospital-based time bank that's been started there, and according to the video, and maybe it's more now, there are like 600 some active members in 2011. So it provides a bunch of different aspects to this program, including a community exchange for aftercare, so post-hospital visits, helping people with care after they leave the hospital, medical interpretation, which is a huge problem in we have that issue here with a lot of very diverse communities. As mentioned in the video, there's 28,000 patients who need translation services at the hospital with only 7 on-staff interpreters, so they need more just community members helping with translation. And then there's a project called Wheel Time where they actually provide medical transportation so people can get to and from appointments and the hospital and so on. And some of the things which came out of the video, which I just jotted down here, like part of it is like we have this sort of mentality or conception that people are always needy. We get really fixated on community need assessments, when really we should be looking at what assets people have to provide first. A lot of people have something they can contribute, so it's just not like me, give me something, sort of charity complex. Like how do we get beyond that? That better health is not necessarily provided by more medical care. We could argue in our country we have the exact opposite. It's the most expensive healthcare system in the world with some of the worst healthcare provided in the industrialized world. Why is that? Jesus didn't get money for healing people. Okay, so need to ask why people are not, that's my editorial comment. That wasn't mentioned, that was an editorial comment. Need to ask why people are not healthy. Why are people not healthy in the first place? And focusing more on preventing unhealthy situations or illness in the first place. Home-based care is not often provided or very poorly provided by our current healthcare system. And so more holistic healthcare access would include all sorts of things. And then the video they talked about, alternative medicine or holistic medicine, Tai Chi, yoga classes, all sorts of things. Then they also mentioned another example was this Community Connections Time Bank in New York with the Visiting Nurses Association. And what was interesting about that, I thought, was there's this sort of reciprocity amongst the members, which came out in like the surveys they did of the participants, that not only were like 2/3 of the people reported that the time bank actually increased their access to services, which is what time banks are supposed to do, but also 98% of the people surveyed reported that the time bank enabled them to help other people. So like it wasn't just to give me something, and they were able to help other people as a part of the reciprocity model. So that was really exciting to hear that. People reported that. And then Kristen shared some of what the Dane County Time Bank is doing in the wellness project. There's this relatively new project involving medical transportation for people needing dialysis, and I think you said 44 trips last month, 2,000 miles. So, I mean, that's pretty impressive that, people are getting access to dialysis who need transportation. There's a small gas stipend provided, but, it's basically time bank relationship being established. The Time Bank Wellness Project also has been having these monthly community meals and workshops, and recently these wellness fairs, which sort of involves, sharing local food, people learning how to prepare food that's healthy, information, skill shares. So those have been really popular, and I've participated in several of those, and they're quite fun and useful. There's been this latest thing to do outreach to seniors about the food share benefits, and we've already talked about there's some stigma attached to using food share, so how to get beyond that. And then the latest thing is this neighbor-to-neighbor care teams effort, where you're trying to provide, not only things like transportation and companionship, but possibly access to other resources. Some other examples that could happen would be minor maintenance projects, help with filling out paperwork, medical, picking up prescriptions or getting to appointments. So then we talked a little bit about how people should be given credit for the services they provide their neighbors. It helps break down the barrier to asking for help. Because there's that often people feel bad about asking for help. But if it's part of a reciprocity relationship, then people don't feel so bad about asking for help, because then they're able to give something in return. So that's a good part of the Time Bank project. One of the needs with these neighbor-to-neighbor things is like to try to build them on active community-based hubs. So we may already have, like some sort of institution or whatever in the community which is already providing like a place where people meet and share their needs and resources. So this could be like a neighborhood center, it could be a faith community, it could be a co-op, it could be a neighborhood association. So how can we sort of match up the people, these existing leaders in the community, with active people, and then bridge the gap between these needs and assets. So that's something we talked a little bit about. This new effort to do sort of door-to-door outreach with the Time Bank, like actually going and talking to neighbors, finding out, are you interested in the Time Bank? Explain that to them. Food share options that are available to them, neighbor-to-neighbor care teams. These are the things you could be involved in. So sort of doing that actual, meet your neighbor, find out what's going on, see if they want to get involved. So because making connections is a really important part of building the community. So that's what it's all about. We had some discussion about Dane County Human Services, has a big pot of money, for instance. I'm sure this is true for most counties, where they're trying to provide services to people who need things. But the amount of money it costs to put one person into a facility for full-time care is like phenomenal. And maybe that money would be better spent, like say, helping have a neighbor-to-neighbor care team coordinator that could meet that, home-based needs being met, rather than devoting it to just a few very expensive, facility options. So, and we talked about sort of other more holistic healthcare options, like it was already mentioned, like therapy for veterans or other people, like through gardening or walking dogs or animal, interactions, teaching cooking skills, people who need better nutritious food. Somebody even mentioned that, well, there's Time Bank members who have land. Wouldn't that be a neat exchange where they could provide land in exchange for someone who wants to learn how to grow food, and that could be a Time Bank, relationship built around agriculture and healthy food. And let's see here, and then we were left with this big question at the end, which I think, Kristen sort of suggested we can maybe talk about this more, but there's this whole fiscal crisis is happening. I would argue it's part of the bigger whole sequestering, like let's just gut all our social programs in the country, but in exchange for other things, just bailing out banks or military. But we have mental health programs that are pretty much now being thrown under the bus. Folks are being deinstitutionalized, not getting the services they need. But then we still have these agencies, public service agencies, which sort of have this mindset about they need to provide all the services through these, someone described as a wraparound program. But like we're going to have this, instead of the big blue blanket, it's going to be a big blue something, something else. But it's not funded properly. So maybe how could Time Bank fill that? I would argue filling the gap. How could Time Bank be maybe a safety net for this situation and maybe provide, I mean, if there is limited funding available, maybe the time bank would be a better way to spend that money than trying to maintain these unsustainable programs.
So that's it.